very interesting also. And part of my research, I discovered other things like Florence Nightingale, also known as the Lady of the Land. During the Crimean War in 1855, just during 5 months, she decreased the death rate from 42% to 2%, just by improving the sanitation system. Why this lady was called the mother of the nursing?
In the days of Florence Nightingale, nurses were considered little more than prostitutes. They didn't know how to read, they had no training whatsoever. What Florence Nightingale did was she took young girls and she gave them a systematic training. She put them in a hospital-based schools where they learn how to do skills like how to bathe, how to change dressings, how to do everything systematically so that it was the beginning of the scientific method, so that the outcomes could be repeated. And by doing that, they were able to decrease the infection rates. So every year, nurses celebrate Nurses Week at the birthday of Florence Nightingale because she's the mother of nursing.
That's very nice. Something else I discovered during the research is that the National Institute of Health states that sudden infant death syndromes decreased 50% from 1994 to 2000, and HIV/AIDS related deaths decreased 70% from 1995 to 2001. By research and the research being communicated to where it can be implemented in the nursing practice. What is the role of communication in this healthcare field?
Communication is key, and everything revolves around communication. The nurses have to communicate with each other through report and through communication when patients transfer from one floor to another, but also to communicate with the doctors, we have to be very concise and we have to be very precise and let them know exactly what's going on and what the symptoms are and what's going on with that patient so that they can accurately make the diagnosis and give us the right medications to be able to give to that patient, because it can really reverse the fact that they may start to go downhill. You know, if we give them the wrong information, they may order the wrong medication, because a lot of things are done over the phone. The nurses are the eyes and ears of the physician. They're not around all the time, where the nurses are. So they depend on us, because we have to be able to tell them what's going on with the patients. So we have to be able to communicate that effectively in order to give good care to the patients. Also, we also have to communicate with the patients themselves and also with the families, because the patient teaching with the patients and families are so important, because now prevention is so important, because we can prevent so many different things. If patients learn to take care of themselves, we can prevent the serious onslaught like diabetes. If patients learn how to control their blood sugars, then they don't end up going blind or losing their legs from amputations. If they learn how to examine their feet so that they don't get sores on their feet, they don't have to lose their legs. You know, if they take care of their hearts, then they don't get heart attacks. Or you know, they take care of their blood pressure, then they don't have to go on dialysis. So many things have to do with patient education and prevention.
That is very important too. And how do nurses implement research?
Nursing research is different than physician research. Well, we have our own nursing diagnosis and nursing implementation and evaluation. That's how we decide how we're going to carry out our plan of action or our we have different committees in the hospital, clinical practice committees, shared governance, quality improvement, where we track different things in the hospital, and we can check out infection rates and things like that, so that we can be able to see if something that we're doing in the hospital is making the infection rate better or making it worse, and how we can change our clinical practice to improve the patient outcome. In other words, cut down on infection, or cut down on the amount of days that a patient needs to spend in the hospital, which decreases the amount of money that needs to be spent on healthcare.
Which is important, not having to spend so much money on healthcare. All right. Well, it seems like new research comes out every day. How do you keep up with it?
There are many, we do continuing education credits that you have to use so many credits in order to renew your license every 2 years. But in addition to that, every specialty has their own continuing education credits. The hospitals mandate a certain number of mandatory programs that you have to do every year, but then each specialty has their own symposiums and things like that. And each specialty has their own journals also. So there's many different ways to keep up with the upcoming research.
Okay, that's good. Well, I have something very specific to what you probably do every day. If you notice a decline in a patient, what are your priorities?
We call it the ABCs of nursing: airway, breathing, and circulation. If there's no airway and there's no oxygen getting to the lungs, then the heart actually stops. So everything is airway, breathing, and circulation. So you have to make sure that there's enough oxygen, that the lungs are circulating the air, that the heart is beating. Those things, you know, if the heart and the lungs don't work, then nothing else matters. But the teamwork is so important in nursing. And whenever there's a problem, you know, you'll think you're the only one on the floor, and people come out of the woodwork, and everybody takes care of everything. One person's calling the doctor, another person's calling rapid response, one person's getting the EKG, one person's checking the oxygen, another one's checking the blood sugar, somebody else is calling respiratory. There's so many people that come out of the woodwork to help this patient, and it happens immediately, and it happens systematically. I mean, and this is one of the great things about nursing, is that we all work together, and there's nobody that's someone is better than someone else, because everybody is there for the focus of that patient.
Well, thank you so much for your time and your answers. They have been just wonderful, and I will be using all that information for my career.
Thank you.
Thank
It's
you.
been a pleasure.